I'm Bianca Frogner. I'm the chair of the webinar committee. I'm also part of the award network leadership team. I'm a professor at University of Washington in Seattle, and I direct the Center for Health Workforce Studies. Today, we have an exciting conversation with a group of individuals from VAs from across the country, which is exciting. And they will be talking about nursing assistant job satisfaction and burnout. But I will get back to our speakers in a moment. I want to first just share some things happening in the award network. As always, you can these webinars are recorded, and you can find our webinars on the website. You can use the QR code there on the screen to find those webinars, including the one today that's being recorded. And we always want to hear from you about ideas about future webinars you want to hear about. So please do share that with us. There's a link also that you can get to via that QR code. Our next webinar will be coming up here in September. It's going to be about family caregivers in the dementia as part of the dementia care workforce. So please make sure you register and join that. And again, you can find that on our website. Let us help you disseminate your work and share your accomplishments. We have a newsletter. If you are not subscribed to it, please make sure you subscribe to it. And you can you can subscribe to that from our website, but you can also email us at awardnetwork@ucsf.edu and let us know about any of your publications or awards you have received or any other news you have to share with our community. We will certainly want to put that in our newsletter. And so please don't delay. We're trying to pull together our next one here. So let us know about your accomplishments. Let us help you get your work out there. Oh, and I'm sorry, I actually added GSA's logo to the bottom of that last slide. I meant for it to be on this slide. So save the date. GSA is coming here in Boston in November. I think many of you are starting to prepare for this, to register for the conference. So make sure you save the date for our Award Network annual meeting. It is going to be taking place on Thursday, November 13th, starting at 11:30 a.m., going to 4 p.m. More details will be coming via email. You will have an opportunity to register for that event. Last year, it was great. We had a range of our Award Network members share a bit about their work. And I also spoke at the event. And so it was a great community of people. We try to feed you a little bit something. So come join us. It's going to be taking place at the Marriott Copley, specifically the Wellesley Room. I want to thank our webinar committee members. This whole series could not be done without the amazing work of our members. The webinar today was organized by Megan Gately. Unfortunately, she's not feeling well today, so I'll be emceeing the event, but Megan is the one who helped to coordinate us today. And then, of course, I want to thank our leadership committee, led by Joanne Spetz. The team has been a great group pulling together all of these events, not just the webinar, but also our Summer Institute, which is going to be coming up very soon again next summer. So keep that in mind. But we have a lot of other things happening in the award network. So please, again, check out our website. And all of this is supported by the National Institute on Aging. Of course, the views expressed in these webinars and other presented materials don't reflect the official policies of Department of Health and Human Services or NIA. Okay, so with that, I'm going to ask our speakers to go ahead and come off onto camera. And Catherine, I'm going to ask you to pull up your slides. And as you do that, I'm going to go ahead and introduce our speakers. As I mentioned, we have 3 speakers from across the country, all part of the VA system. So first up will be Catherine Kennedy, who is a social gerontologist and a health services researcher at the Transformative Health Systems Research to Improve Veteran Equity and Independence, or Thrive Center of Innovation, also called a COIN, which is located at the VA Providence Healthcare System. Dr. Kennedy received a Vision 1 Career Development Award from the Department of VA and to conduct her study on understanding the role of nursing assistant training on veteran and staff outcomes in VA community living centers, pilot to national study. She is passionate about conducting healthcare workforce research to benefit care recipients and staff well-being. And Dr. Kennedy has been a longtime member here of the Award Network, so great to have her here. Kate Ackman. She is the Director of Education and Training and Designated Learning Officer at the Toma, Wisconsin VA Medical Center. Dr. Ackman is a certified trainer in positive approach to care and serves as the chair of the facility's Dementia Committee, as well as a member of the Vision 12 Dementia Committee. And then our third speaker will be Cherise Blackburn, who is a clinical instructor at the Tuscaloosa VA Medical Center. She serves as a facility educator with a focus in geriatrics extended care. She is a facility trainer that serves on the Falls Committee and the Wound Care Task Force. So I'm really excited to hear this conversation, and we'll hopefully have a little bit of time at the end for Q&A, but I do want to encourage folks to put your Q&A in the Q&A function at the bottom of your screen, and I will help to facilitate that at the end. So with that, Catherine, please go ahead.
Thank you so much. I'm so excited to be here. Can you see the slides?
Yes, they look great.
Okay, great. So today, the topic that I'm presenting is all about how to promote nursing assistant job satisfaction and lower burnout, lessons from Veterans Health Administration nursing homes. And I'm delighted to be here with my colleagues, Dr. Ackman and Cherise Blackburn. They have supported my research since I've been at the VA almost 4 years, so it's a real treat to present with them today. These are the disclaimers and acknowledgements. The views expressed in this presentation are those of us and do not reflect the position of the Department of Veterans Affairs. The funding is provided by my Vision 1 CDA, and I'd like to acknowledge that the data I'm presenting today were collected, organized, and really the efforts of the U.S. Department of Veterans Affairs Organizational Assessment Committee and the National Center for Organization Development, or the NCOD. So today I'm really talking about a passion project, a paper that is a work in progress, and the topic is investigating relationships between burnout and between nursing assistant professional development, workgroup competency, job satisfaction, burnout, and intent to stay. The study fit within my larger project, the aims of which were to characterize the VA community living centers referred to as CLCs in terms of the nursing assistant's job characteristics, outcomes, and demographics between 2020 and 2023. I also wanted to explore how nursing assistant training was associated with job outcomes of satisfaction at work, turnover intent, and burnout. So the research questions that I will answer are to describe the job characteristics, including the perceptions related to knowledge, skills, outcomes, and demographics among CLC nursing assistants in this time period. And also, how are the training-related perceptions and age of nursing assistants associated with their job outcomes, specifically to those listed on the screen. I hypothesized that more favorable perceptions of developmental and social resources at work will be associated with improved worker outcomes that would be more job satisfaction, more intent to stay, and lower burnout. I also hypothesized that older nursing assistants will have better outcomes. This is an area that's surprisingly sparse with literature, and that's particularly dated. So, and while some have focused on professional development, none to our knowledge have included workgroup competency or authenticity, which was a variable we had access to in our data set. The research to date has also relied on small samples or used data from the 2004 National Nursing Assistant Survey. This presentation contains unpublished results, so these results are subject to change in the publication process. So who are nursing assistants? They are the primary care partners to residents in nursing homes. The labor force is quite large in community nursing homes. Over 450,000 nursing assistants were employed in 2023 in over 15,000 facilities to care for over 1 million residents. Importantly, this data excludes the nursing assistants that work in VA CLCs, and these settings are VA owned and operated nursing homes. We know from the literature that nursing homes have historically experienced high turnover rates among nursing assistants, and the workforce of nursing assistants in the CLCs is about 4,482 full-time equivalent nursing assistants in 118 facilities, and they care for over 15,000 veterans, of whom over 53% have Alzheimer's or related dementia. Why are we talking about job satisfaction and burnout? These are important well-being indicators. By measuring job satisfaction and burnout, this creates opportunity to intervene and change work practices or resources. We know that job satisfaction of nursing home staff is associated with improved resident outcomes regarding satisfaction, falls, weight loss, and pressure ulcers. We know that when you provide a setting with job resources and also high demands, these are called active jobs. This activates workers' motivation and furthers their engagement at work. And this can produce more organizational commitment, better performance, and improve patient outcomes. This is one piece of the job demands resource theory. We also know that the other side of this theory is the burnout pathway, and that the nursing home setting and the aides working there can experience burnout, which consists of emotional exhaustion and cynicism. And that burnout is associated with withdrawal, meaning going away from the situation that is causing you to burn out and essentially leave your job. So the slide here shows the opposite pathway, that high job demands without adequate supports can produce burnout, and that burnout can lead to poor performance, disengagement, sickness, absence, and turnover. So this is a critical theory that is used to describe these relationships. Job resources like developmental and social promote worker well-being and positive outcomes. So 2 factors, professional development and work group competency, why do they matter? Professional development means there's opportunities to learn and to grow. So this would be considered a developmental resource in the theory. The existing literature regarding nursing assistant professional development shows that it is associated with enhanced job satisfaction, decreased turnover rates, and improved patient outcomes, such as reduced use of restraints and incidence of pressure ulcers. The other factor that we're examining in the study is workgroup competence, which is a unique variable from our data set. This factor is defined as when coworkers have the job relevant knowledge and skills to achieve organizational goals. This is a social resource, part of the job demand resource theory. We also know in terms of demographics that older workers may use job crafting and specifically cognitive job crafting to enhance their own workplace satisfaction. So the methods. This is of a larger study where we used a multi-site case study approach. But for this paper, this involved a retrospective cohort design where we applied a longitudinal cross-sectional analysis of employee survey data. We used the all-employee survey from the U.S. Department of Veterans Affairs, and we restricted our sample to nursing assistants who primarily worked in the CLC. We also analyzed demographics, but we were most concerned with two items. One was professional development, and the variable was I am given a real opportunity to improve my skills in my organization. The second item was workgroup competency, which I defined previously regarding your work unit or coworkers having job relevant knowledge and skills. We also controlled for other factors in the theoretical model. Social resources included supervisor support for work-life balance, workgroup respect, authenticity, and reasonable workload. And the key variables were on an agreement scale, which was a 5-point Likert scale. Oops. So our outcomes were all binary dependent variables. Job satisfaction was a single item, considering everything. How satisfied are you with your job? Based on a 5-point Likert scale of satisfaction. And we defined it as those who were very satisfied or satisfied compared to the 3 other categories. In terms of burnout, we looked at those who experienced 2 or 3 high exhaustion, high depersonalization, or reduced personal accomplishment at least weekly. And for intention to stay, that was based on a single item. And we considered those who do not intend to leave in their job in the next year. So apart from the descriptive and bivariate analyses, which were correlations and chi-square test, we estimated adjusted Poisson models, but we used the Poisson command in SAS to estimate a risk ratio regression. And so using this approach, we report the incidence rate ratios by exponentiating the regression coefficient. And with this model, the IIRs are a direct estimate of the risk ratio. So that is primarily what I will report. And we did sensitivity analyses by year. So our analytical sample mainly included non-Hispanic nursing assistants. The majority were age 50 to 59. About 83% were women. 41% were Black or African American, and 35% were white. And these statistics align very much with the PHI report on nursing assistants in community nursing homes. Additionally, over 70% reported they were satisfied with their job. About 23% were burned out, in terms of 2 or 3 high burnout symptoms weekly, and 74.7% reported they would stay in their jobs over the 4-year period. In general, the responses were um, less positive on professional development than work group competency, um, and also less positive in terms of work group respect, and more positive in terms of authenticity, reasonable workload, and supervisor support for work-life balance. Importantly, we did show that among those who intended to leave, the majority were within the VA, and the top reasons were job-related, such as workload, personal family caregiving, and professional factors among those who intended to leave. For job satisfaction, we found that a 1-point increase in professional development increased the rate of job satisfaction by 7.8%. We found that a unit increase in work group competence was associated with a 6.8% increase in job satisfaction. Authenticity was associated with a 13.3% increase in job satisfaction, and nursing assistants who were aged 26 to 29 reported job satisfaction rates that were 21.5% lower than those who were 60 plus. Our other analyses confirmed that these results remain consistent over time. Now for burnout, we found that a 1-unit increase in professional development was associated with an 8.4% decrease in the rate of burnout. Work group competency was not statistically significant. The largest factor that impacted burnout was having a reasonable workload, and nursing assistants who were ages 26 to 29 had burnout rates that were 72% higher than nursing assistants age 60 and older. This pattern repeated in the youngest age group, those 30 to 39 and 40 to 49-year-olds. And we looked by year and found that the significant negative association between professional development and burnout were only observed in 2021 and 2022. But burnout differences by age group were consistently observed across 3 out of the 4 years. Finally, with intention to stay, we found a unit increase in professional development was associated with a 3.8% increase in intent to stay. Unexpectedly, we found an increase in work group competency was associated with a 3.6% decrease in intent to stay rates. We looked at job satisfaction and burnout as predictors of intent to stay in our final model, and we found job satisfaction, a 1-unit increase, was associated with a 19.1% increase in intent to stay. Individuals experiencing burnout symptoms weekly were associated with an almost 24% decrease in intention to stay. And again, we found an age was significantly associated with intention to stay. Particularly those who were 30 to 39, 40 to 49, and 50 to 59 had higher rates of intention to stay than those who were 25 and under. So our findings align with what is known about professional development in its promotion of satisfaction and intent to stay and reducing burnout. However, our findings about work group competency on NA job satisfaction are new and novel. The unexpected relationship between competency and intent to stay could be explained by turnover to other positions within the VA, potentially another role or another neighborhood. We demonstrated that several JDR factors are associated with both enhanced job satisfaction and less burnout, notably authenticity, reasonable workload, supervisor support, and work group respect. Job satisfaction and burnout were the strongest factors associated with intention to stay, and we found consistent effects of age group on outcomes. While our study uses VA-specific data, these results do have implications for research, practice, and policy in other post-acute long-term care settings. Oops. So the limitations of our study are that the measures in the all-employee survey do not follow standardized scales, and this is a limitation to their construct validity. Additionally, we in the pooled models, we may have the same people responding year to year and may not be independent observations, which is why we did the sensitivity analyses by year. And this was because the anonymous nature of the organizational survey. However, we believe this is the first study to evaluate nursing assistant views about professional development and work group competence in the VA setting. We had a large analysis sample, about 2,000 participants per year, and our sensitivity analyses showed the findings were robust. Particularly, the buffering effect of professional development on burnout in 2021 and 2022, which were right during the height of the pandemic. Implications for practice and policy, and I will wrap up shortly. So regarding practice, this study implies that enhancing professional development might improve job satisfaction, burnout, and intention to stay among nursing assistants. This could be from orientation to continuous education, career development programs, and online learning or micro learning. The burnout mitigation interventions are important because data from VA CLCs indicates that emotional exhaustion and cynicism were higher in 2023 than in 2019, and burnout has not returned to its pre-pandemic levels. Nursing assistants aged 25 and under may benefit from additional supports like mentorship to be retained. Nursing homes have a priority to ensure nursing aides can identify and address residents' change of condition related to the FTAG 726, and that the team understands nursing assistants' vital role on the interprofessional team. Key training areas to support nursing assistants include effective communication, teamwork, and including nursing assistants in communications with nurses. This study and other studies demonstrate and advocate for more routine use of surveys of nursing home staff experiences on the job, including burnout and patient safety culture, as the AHRQ recently released a new survey measure called the SOPS Nursing Home Survey 2.0. And regarding policy, one of the ways nursing assistants receive professional development is ongoing training and initial training in safe patient handling and mobility. This has been a pillar of VA practice for over 2 decades, and I believe there may be a gap in federal regulations for similar programs in community nursing homes, and the necessary resources to implement such a program. And finally, further study of staff development is needed, particularly in community settings where there are known resource challenges. Surveys with representative samples on these factors would inform organizational change at multiple levels. So these are the several areas that could improve research, using reliable and valid scales, investigating both technical and relationship-centered competence. And this is surely an exciting time to study healthcare workforce research, and the long-term care workforce, particularly with the National Dementia Workforce Study surveys being available, and the ability to use multi-level modeling and study setting-specific job resources, personal resources, and job demands. So in conclusion, improving professional development and work group competency may improve nursing assistant job satisfaction. Also, nursing assistant well-being regarding their burnout might be protected with offerings to improve their professional development. And finally, the enhanced professional development for nursing assistants may result in improved patient care. So thank you so much for listening to my presentation. This would not have happened without the mentorship team on this project, and also to the VA and COD. So next, I'd like to introduce you to Dr. Kate Ockman, and she will dive into aspects of professional development, specifically scholarships and tuition reimbursement and career development programs for nursing assistants at the VA.
All right, thank you. So the VA, we have many professional development opportunities available for nursing assistants as well as staff in general. So I'm going to be discussing national scholarship opportunities that nursing assistants may utilize if they're choosing to further their career. In discussing these, I'll give the perspective of our local site. Each VA really has the ability to determine whether or not they're going to offer some of these programs, but there are standards nationally for how these programs are implemented. So next slide. So the VA, we offer scholarships for a multitude of reasons. Hard to recruit positions, retaining staff, is one or two of the reasons why. Growing our own future organizational leaders to continue to meet the VA's mission, of course, is also a key reason why we offer these types of programs. And really hoping to encourage innovative ways to enhance the quality of care that's provided to our nation's veterans is another reason, and probably the most important reason why we offer these scholarship programs. So the more commonly used programs will be shared in the upcoming slides. But we do also have additional programs that can be offered to help staff to pursue higher education, and those are more student loan repayment type of programs. So next slide. So like previously stated, each VA facility has the option of offering these different programs. So there's the Employee Incentive Scholarship Program, or EISP, the National Nursing Education Initiative, NNEI, and then the VA National Education for Employees Program, which is referred to as VANEEP. The decision to offer the program is really based on the individual needs of the facility, with some sites offering all three. That is what our site has chosen to do. Other sites offer a couple or do not offer any. The facility really has to offer the programs based on the needs of their facility. They can choose to offer them, and if the need is no longer there, no longer offer them. It's really up to each facility. And so many offer the programs continuously. Nationally, the scholarship cycle follows our fiscal year. So right now we are currently in the process of accepting applications for fiscal year 26, which starts in October and ends in September 2026. The national scholarship submission cycles follow that window, funding coming from national programs through versus each independent site funding them. So EISP and NNEI are very similar in that they allow for individuals who are seeking higher level degrees in their current field to return to school, and then the scholarship would cover tuition fees. The employee still works in their role while they are in school, but they are receiving that tuition reimbursement. NNEI is very specific to nurses, where EISP is really open to any staff member that is in a Title 38 or hybrid Title 38 position, so more of our clinical type roles. And EISP does also allow for the individual to return to school and change occupations if they choose to, without attending school full-time. So if they're wanting to do part-time school and still work full-time, they would apply under EISP. VANEEP is a really unique program that is designed for those who are entering school for either first-time licensure or certification. They have to be pursuing a degree that's considered Title 38 or hybrid Title 38, which again is generally those clinical type fields. With these individuals, they are enrolled full-time at school. So with this program, they attend school full-time. They do not work their normal tour. They go to school during the week. They receive their full-time pay. They receive their regular benefits. However, they are only working on campus during times of extended break from school. So a really nice program that allows folks to solely focus on their education so they can then bring that degree back to the VA in service of the veterans. For those who are enrolled in that program, the facility does receive a replacement salary for them, so we are able to recruit and have someone in their role to cover that need while they are in school. And at our facility in Tomah, VANEEP is generally used by nursing assistants if they're seeking a nursing degree, which is generally what VANEEP is used for at our site. However, have had some utilize it for licensed professional mental health counselors, things of that nature. But VANEEP is definitely the program that is more oftenly used by nursing assistants at our site, and is one that is very highly sought after. HPSP is the Health Professional Scholarship Program. This is a nationally run program that's run independent of VA sites. It's designed for folks who are pursuing a degree in certain disciplines based off of VHA-wide workforce needs. So each year they update those, and then both VA and non-VA employees can apply for that program. And then VA STEP, this is a program that is utilized for trainees. So the Student Trainee Experience Program, it's available for nursing, medical laboratory scientists, and pharmacist students, and it allows for paid trainee hours to be completed at a VA facility while they are in school. Next slide. So there are requirements for participation in the scholarship programs for EISP, NNEI, and VANEEP. They do have to have 1 year of service to VHA prior to the application submission. Many VA facilities do require for that 1 year to be completed at their site prior to submitting to national. The employee has to be in a permanent position. They can't be a temporary not to exceed position. And the employee has to be either full-time or part-time. For the school that they're attending, it has to be accredited, and they have to be unconditionally accepted into that program at the time of application submission. We do have funding limits and also credit limits. The funding limits do change. They're reviewed annually, and they are changed to reflect current costs, general costs of credits at schools nationally. Credit maximums generally do not change. So 90 for undergrad and 54 for graduate. That is a total amount under scholarship as a whole. If you were to utilize VANEEP to receive a degree in nursing and then chose to use NNEI at a later date for, say, a master's or doctorate degree, we would count the credits you have already used into your totals for semester hours. For Van EAP, we do have to have folks complete their degree within 2 years. EISP and NNEI, we have a little bit more leeway, 3 years to complete if they're full-time, 6 years if part-time. And that is because we're giving consideration to the fact that those individuals are also working while in school. Facility has to commit to hire the individual into the role prior to submitting for the scholarship. It needs to align with whatever degree they're going for, and they need to be in that role 180 days after they have completed their degree or have obtained licensure certification. All of the participants will complete some type of service obligation period within the VA. Generally, it's served at the VA in which they receive the scholarship. We do have the ability to have the person transfer to a different VA facility if the need arises. However, it's generally encouraged they stay at the VA in which they received the scholarship. Next slide. So for HPSB, with it being a national program, what they offer is tuition and fees to be funded while the person's in school. Because it is open to non-VA employees, if you are a non-VA employee who applies for it, they also do give you a monthly stipend in order for you to really dedicate your time to school. A service obligation is owed to the VA when you're done with your degree. And with HPSB, it is the expectation that you will move to wherever the need is within the VA system. We do have individuals who will connect with the VA prior to applying for HPSP, and that site can indicate to National HPSP that we plan to take on that individual for their service obligation period. For those that do not have that, that selection made ahead of time, it really is open to whatever VA site is needing that role with their recruitment. So at TOMA, we have had individuals move from Colorado to complete their service obligation period within our facility. Obviously, the hope is that upon completion, they will stay, but they are able to return to their home area, hopefully within the VA system upon their service obligation completion. Next slide. And then finally for VA STEP, this is that training program there. So if selected for it, they get 400 hours at a VA facility with the potential for another 400 hours of experience during the school year for a total of 800. With this program, they're not obligated to a site, but the goal is we will hopefully recruit them for a permanent employee. And then next slide. So local level professional development. VA offers really a large amount of local level opportunities in addition to those national scholarship programs. Competency completion, of course, is something that is required both initially, annually, and then just in time based on needs. National directives and action items will dictate specific training needs at times. However, the VA does allow a lot of flexibility from site to site to really develop local training content to meet individual needs. Training program resource sharing is really common within the VA, which is nice. We don't have to recreate the wheel. And then we have communities of practice throughout formed for different topics. Regular skill or education fairs are a common thing within the VA system, really to maintain that work group competence. And then we utilize an online learning management system called TMS, or the Talent Management System, to track and deploy training. And then local programs are in place for professional development for staff, leadership development programs. We are in place to both grow formal and informal leaders. We have school at work programs to help prepare staff who want to return to school. Preceptor and mentorship programs are utilized in order to prepare individuals to precept and mentor new staff coming in. They're also used within our leadership development programs and school at work programs. And then we also have some sites within the VA system that offer certification type programs, whether it be through offering testing for state certification or prep courses to qualify for certification. And then we also offer those opportunities to be trained as a trainer for internal VA programs. We have trainers that for our prevention and management disruptive behavior program. Those are available at national and local level, as well as other internal training programs. Next slide. So my contact information is listed, as well as contact information for the different scholarship programs. And then I'll turn it over to Ms. Blackburn to talk about local level professional development and training.
Thank you, Kate. And so I'm going to go over and what we had. We did training here at the Tuscaloosa VA just recently in June with our nursing assistants, and it was more of a foundational training. So a review of the nursing assistants' professional development competency on a local level, and as Kate has already, as Catherine has already stated, the research shows developing professional development opportunities may benefit nursing assistants' job satisfaction and intent to stay. And the state CMS regulation states nursing homes must ensure that nursing assistants can identify and address a resident's change in condition. And that's one of the things that this foundational training was for, so that we could refresh our staff on recognize the change in condition and worsening in the patient's condition. And that they, nursing assistants, and so that the team will understand that nursing assistants have a vital role on the interprofessional team. Next slide. So we titled our foundational training as the CLC Beacon of Excellence. And so I'm just going to specify what we did with the nursing assistants, although this training was for everyone. And so it was nursing assistants recognizing, reporting, and documenting abnormal observations. Next slide. And so for our foundational training, we held week-long training from June the 2nd through the 6th. Our Tuscaloosa VA Medical Center Education Department was tasked with, of course, conducting this training, getting it together, and that's exactly what we did here in the Community Living Center. This training included all nursing assistants, LPNs, and registered nurses, but I'm going to focus on the nursing assistants part. The training consisted of lecture, skills competency, and scenarios. Our training time each day was 6 a.m., 10 a.m., 1 p.m., and 4:30 p.m. And so even though the whole education department was a part of it, we did have assistance from the CLC team, and we also had assistance from leadership. And this training was conducted in 3 to 4 hours training sessions each day. Next slide. And so in recognizing the change in condition, first we wanted to let the nursing assistants, we know that they are not to do assessments, they do observations. And so we wanted to use this to have them home in on their observational skills that require, good judgment. And, we talked to the nursing assistants about what would happen if they didn't report, and then to anticipate a change. We explained to the nursing assistants, and we talked and discussed about knowing the patient baseline, realizing that here at our CLC, the patients are here. I mean, it's a home-like environment. This is their home. And so we do expect all of the staff to know our patients, to know their baseline. And then we wanted them to make sure they reach out for second opinions. And so nursing assistants may wonder, how do I reach out for second opinion? Well, go and talk with another nursing assistant or someone else who's caring for that veteran and ask them, collaborate, do you see what I'm seeing? Have you noticed a change? We talked about normal versus abnormal changes. And then we explained that early detection and intervention is key. And that's when our scenarios came in, trying to pick up on things very early so they don't worsen. And that is everyone's responsibility. It wasn't just the nursing assistants, even though they're frontline staff, they are closest to the patient, but it's everyone's responsibility to recognize a change in condition. Next slide. And so, in doing our observations, talking with the nursing assistants, we did a systems review, and we talked about each one of these things, which I'm not going to talk about today, but we just, we went over each one, and we had scenarios for some of them about, vital signs, if they notice an abnormal blood pressure that's too high, or if the patient has a temperature, that's something that needs to be reported soon on. And then we even talked about if the patient hasn't had a bowel movement in 3 days, why it could be happening and why it needs to be reported. Also, when it comes to a patient not drinking, they notice that the patient isn't drinking during breakfast and lunch. They know the patient has had some emesis, or if the patient has had diarrhea, and all of this can lead up to the patient being dehydrated. And then, and I'm sorry, next slide. And recognizing the change in condition, we reviewed the stop and watch, the early warning tool. And so we went over several of these things to talk about. And as in and ate less, no bowel movement in 3 days, or diarrhea, and drank less. And as I said before, this could lead to our patient being dehydrated. Realizing that, in our CLC, our elderly are already of age, and they're not probably drinking as much as they should. And so any little change in this can kind of tip the scales with them and going, down. And so we explained that, early recognition is key. Next slide. And so we talked about, because, we listened, we did talk with our staff, the employees, about a change in condition and who to report it to. And so we said there to go through the chain of command. And of course, as the nursing assistants see, it started with them, nursing assistants, frontline staff closest to the resident, who knows that patient a little bit more because they care for them consistently. Because here at the Tuscaloosa VA, we have consistent assignment. And so who to report it to. And then if you see in red, escalate to the next level if not resolved. Then if the nursing assistants, no one listen, we all have a responsibility to report it to the next level, but not to let it go. Next slide. And so we talked about documentation here at the VA. We documented CPRS, and so we would have the nursing assistant document in the GEC nurse note. We did explain to them that they needed to provide a face-to-face verbal communication with the charge nurse using closed loop communication, and then to add the charge nurse who they reported it to as an assigner. Next slide. So recognizing a changing condition, communication is key. Early recognition and reporting the change of a patient's conditions to the nurse is essential for patient care. We homed in on that not reporting can lead to further complications. We wanted them to be clear and concise and stating the facts when reporting. And again, not communicating can cause a negative event for a patient. Next slide. So in conclusion, we trained 99% of our CLC nursing assistants, and we did have to add on a couple of days, but the majority was trained within that week. But we had to add on more days, to catch those that were off and on vacation or something. Per survey, we did provide a survey after our training, and majority of the nursing assistants enjoyed the training, especially the scenarios, and they found the training to be highly beneficial, and that was with the skills. And then they reported training, they asked and requested training to be completed more often. Also, communication between the nursing assistant and nurse is crucial for patient safety. And then nursing assistant professional development and work group competency enhances quality patient care. Next slide. And that is the end of my presentation. I do want to thank my leadership and my supervisor, Ms. Marshanda Burrell, for this opportunity, and of course, Ms. Catherine Kennedy. Thank you.
Thank you so much, Sharice, Kate, and Catherine. What a wonderful and rich set of presentations, and such a nice compliment to see not only identifying the needs of nursing assistants in the VA, but also ways in which the VA has actually been approaching and supporting nursing assistants. I saw one question come in. I think it came during Kate's presentation. And again, to the audience, we just have a few minutes, but if you have any questions, feel free to put in Q&A. The question is, what is the uptake of the educational benefits among nursing assistants? And do you know anything about the attrition rate of people in these programs?
So I do not have data readily handy on nationally. From a local level, we submit usually about 5 per year for scholarships, depending on the year, and 90% of them are nursing assistants. Our facility has a lot of nursing assistants interested in Van Eep, so they can return for nursing full-time and focus on school. And so that's generally the highest sought after program we have. Turnover-wise, with folks who are in under scholarship, we have very few that leave during their service obligation period, which is generally about 3 years. Folks who go through Van Eep or any of our scholarship programs are generally to stay in school, not only because they have that need to complete that service obligation, but because also of the opportunities to either stay at our site and transfer through departments that they feel best meet their needs, or the ability to very easily transfer to other VA sites that have different opportunities, and so generally are able to retain quite easily. With all of our folks who do go through scholarship programs, and really any new nurse that comes into the VA, we do have the transition to practice program that's nationally required for their first year as being a nurse. So that also is a big means of recruitment for the VA, having that program. But nursing assistants generally are our folks that are applying for Van Eep at high numbers.
Great. Great. And maybe one question for you, Catherine, is whether, it is really interesting to see how you said the work group competency, as it got better, they reduced their intent. They were less likely to stay, essentially, right? What might be interesting, and maybe you've already done it, is to look at the reasons why they might be leaving and whether there's some variability in how people are leaving or the reasons for it. But could you just say just a couple more words about why you think that might be happening? That seems like a really interesting area for additional investigation.
Thanks. Yeah, it is surprising, and we've looked at that variable in a number of ways. The associations between work group competence and intention to stay just by itself, and that's positive, as what we would expect. And then, but in our final model, we found that negative sign, and it was a surprise. So one of the explanations might be that those who feel like their team is really strong, so the coworkers have that knowledge and skills, they may have more professional confidence to maybe seek an opportunity. It could be within the VA or outside the VA. So maybe they feel like their veterans are well taken care of by the team, and so I can move on to a different position. And what we heard also in my qualitative interviews was that some nursing assistants move into medical support assistants or MSA roles. And so that's another position within the facility, but they're not exactly leaving the VA. There's a lot of opportunity to move within the VA, and that's what we did see in our descriptive data.
Well, thank you so much. I mean, it gives lots of food for thought. It's great to see this information. And I'm sorry we don't have more time to have a conversation here, but I know you all put your contact information in your slides. So I certainly, I hope others will reach out to you if they have additional questions. And I just see another comment from the audience members just applauding your excellent work here and presentation. So thank you so much to you three for giving a great presentation. And thank you to all who participated today. Have a wonderful rest of your day.
Thank you. You too.
Take care.
Thank you.
Thank you.